Hi there, John Fairman from Balanced Physical Therapy and Human Performance Center coming at you with a bit of a story. And the reason I'm going to say that is in graduate school for physical therapy, and even if you've been practicing for a long time, if you have not invested into learning the art of storytelling, you're going to have a much harder time connecting with your patients. And here's why. Recently, one of our seasoned physical therapists who is acting as a clinical instructor for a current third-year student started making some noise to the C-suite in our company, to her clinical director, saying, I'm having a really hard time with this student. I don't know what to do. Please, I need help. You know, this is going off the rails here. So as we all started to chime in, to listen, to learn, to understand what was happening, what became very apparent to us is that the young man who's a student is significantly socially inept. He doesn't want to talk very much. He doesn't want to share very much. He clams up. He literally just doesn't know how to relax and have a conversation and maintain eye contact and be present and be a relaxed, pleasant human being, which is imperative in our profession. I mean, you know that. If you're a PT and you're listening to this, you're like, yeah, no shit. Of course, it's important. Pardon my French. But what we came to as a group is we explained to him in a way so he could understand why it's so important to be able to tell a story. And when we presented it to him as coaching or teaching to learn how to tell a story, rather than telling him that he needed to communicate better, he needed to have better eye contact, he needed to relax, he needed to maintain appropriate distance and body mechanics and not be one of these face talkers in front of his patients, which was really off-putting. He got it. Learn how to tell stories. And the best way for that is to be your authentic self. We've all had life experiences. We've had some amazing experiences, some crappy experiences, and all kinds of experiences in between. Tell the story. Share of yourself. Be real. Just walk your patient through a story while you're torturing them with, knee flexion after a total knee replacement. If you're doing some passive, external rotation range after a rotator cuff repair and your patient's dying on the exam table, ease their pain, tell them a story, connect with them personally. That, more than anything else, will improve the patient experience. Many of our patients don't experience pain. Many of our patients experience terrible amounts of pain coming through PT, and some of them are just absolutely terrified. And being able to connect with them as a human being through storytelling is one of the best things that you can learn as a physical therapist. It has nothing to do with your clinical acumen, nothing at all. It has to do with your presence as a human being trying to help another human being. Tell them a story. Take their mind off of the misery that they may be going through in rehab, or the hopelessness that they might be feeling, or the fact that, they're not the person that they used to be, or the fact that they may never play the sport that they love again, etc., etc., etc. Like, all of these things are happening in your patient's minds. Tell them stories. Have fun, relax, enjoy, laugh, get them to laugh with you. Have fun, for God's sake, and you will become exponentially more sought after as a clinician. Try it on. Thank you for listening.